Well, thank you for joining us this morning on Healthy Living South Mississippi. We're back with Dr. Reagan at Retina Specialist of Mississippi. How are you?
I'm doing very well, thank you.
Thanks for being here. So tell us, before we dive in, we're going to talk today about macular degeneration. Tell us, what is macular degeneration?
So macular degeneration is a degenerative disorder of the retina, specifically the central retina, which is called the macula. It's the part of your eye responsible for the sharp, crisp, clear vision that we all enjoy. And the disease is an age-related disease, often encountered in our later years, and it can result in permanent central vision loss.
So I've seen some commercials about macular degeneration, and I know of two kinds. There's dry and there's wet, I believe. Are there any other additional kinds? And what is the difference between the two?
Sure. So in general, there are the two forms. There's dry macular degeneration, which is the baseline form that most people have, if they have it. The other form is called wet macular degeneration. Both forms can be bad. The dry form typically leads to slow, progressive vision loss of the central vision. The wet form of the disease can be a little bit more unpredictable, but is characterized by abnormal blood vessel growth that can lead to bleeding or fluid buildup underneath the retina, and that can be sometimes very abrupt.
You mentioned vision loss. Other than vision, are there any other issues that we face if we let me start this. What is causing it, and how can we avoid it?
So the big association is aging. Okay, age-related macular degeneration. As we get older, we have a higher chance of some of these things building up and accumulating, and macular degeneration, it reflects that. There are some lifestyle choices, such as smoking was shown to have a huge risk on worsening progression of the disease. So, but most of our risk factors are found in our genetics. It is a treatable condition, and so we do have treatments available for both forms nowadays. The treatments are now eye injections, and so eye injections are considered to be the number one treatment, and they're very effective at often preserving and maintaining vision in this condition.
So we were talking a little bit off camera about the fact that you can maybe begin to see signs of this as early as the 40s, which is a little scary for me. I'm well into my 40s, but is there any particular age group where it is more impacted than others?
Sure, and so even as we get older, you can start to see some signs of early macular degeneration. Most cases of macular degeneration don't result in vision loss, okay? As patients approach their mid-60s or 70s, you're going to have a higher chance of macular degeneration showing up, and even a higher chance of that condition having some effect on the vision. The vision can be, some early symptoms can be something like a distortion in the vision or central vision blurring or spots in the vision missing. But definitely in our 60s and 70s and into the 80s, we do have a higher chance of macular degeneration showing up and possibly affecting the vision.
You mentioned lifestyle choices. Smoking was one of those. Are there any other lifestyle choices that we're making that could be leading to this?
Well, just aging in general, as you know, our overall health and healthcare has allowed us to live a little bit longer. We're seeing some of these conditions show up. There are some treatments that may help slow down the progression, and they're centered around some vitamins and minerals and nutrients. And I do think that reflects how good nutrition and taking care of ourselves can often help stave off some of these chronic conditions.
That's what I was getting at. So those of us who are eating packaged processed foods, it's probably not helping us.
Probably not great. No.
So what, for those people who are watching that are beginning to maybe question some of the things they're seeing, what are some of those symptoms that you probably should be on the lookout for when thinking maybe it's time to talk to a doctor?
So vision loss in one or both eyes, and I tell all my patients to check your vision every day real carefully in each eye. Sometimes we don't know that one eye has problems with it because we've been looking through both eyes. So usually it's just one eye. Distortions in the vision, missing vision, grayed out vision, or worsening progressively blurry vision. You should talk to your eye care provider if you think that you are at risk or you have macular degeneration, or if you're known to have macular degeneration, you should see your eye care provider to see if there is some worsening or progressing of the disease.
I'm glad you mentioned that, because that was kind of tying into my next question. You mentioned your eye care provider. Is this, if we're going to get our vision checked, to, look at the letters from across the room to see if we need to be wearing glasses. Those doctors can tell us that maybe we have a problem. They can refer us to see you, or are you one of those doctors where we can just directly book the appointment ourselves?
Well, certainly I do have patients call up or walk in and find me and ask if I can evaluate them, and certainly we do. But that's not usually the case. Most of my patients are referred from eye care providers in the community, and they are perfectly capable of monitoring for the disease or diagnosing early disease. And should it look like things are getting worse or it's already in a more severe stage at first look, then certainly those patients can warrant a referral over to my office, and we'll evaluate further and determine if treatment is warranted.
Now, we mentioned depending on the varied stages of its advancement, when you're finally seen, it's manageable for the most part. Treatments are for folks that may be concerned about it. Any treatment is going to be better than the alternative. But how are those treatments? Are they painful? Is it something that, some people don't find it painful, others do? How does that?
Yeah, everyone's experience is a little different. I tell everyone certainly catching it early and early treatment, early intervention is always going to lead to better outcomes. And so I want to encourage people to get checked out sooner than later. As far as the treatments go, the eye injections, they do sound scary. We do everything we can in our ability to make them as comfortable and tolerable as possible. Sometimes they're given pretty frequently, and so we do try to do our best to make it as comfortable as possible so patients can continue to get their treatments as needed and not lose vision. I take a lot of pride, and I prioritize patients' comfort and try to reduce any anxiety they may have about getting these treatments. And so I don't want patients to worry about that, and we do try to make things as comfortable as possible.
What does that look like from the first appointment to the treatment? What does that process look like? How long does that take usually?
On average, retina appointments can be very long across the country, on the order of a few hours. We try to do better than that and make our day very efficient. Well, we bring patients in and we check vision. We have to get some imaging and some high quality scans at the same time. I review all those images and scans with the patient all on the same day, and we do very often offer treatment on the first day as well. And so we kind of do all in one, sort of a one-stop shop all on the same day treatment, because there's no better time to get on the treatment and improve or preserve your vision than that day.
Well, and if you're watching this and you're beginning to experience some of those symptoms, I imagine that's kind of scary, and you want those results, or you want that treatment to begin almost immediately if possible. So listen, if you have any questions, especially if this is running in your family, if you're beginning to recognize some of these symptoms, reach out to Dr. Reagan. You see that number there at the bottom of your screen. You see their website. You see all the information you need to give Dr. Reagan and his team a call so they can get you checked out and make sure that you are back on the road to good eye health. Thank you, Dr. Reagan, for being here.
Thank you.